Question 1. A patient presents with symptoms of heartburn and acid indigestion. Which of the following over-the-counter medications would be the most appropriate initial recommendation for immediate relief? A. Omeprazole. B. Ranitidine. C. Calcium carbonate. D. Famotidine. Answer: C. Calcium carbonate. This question tests knowledge of common over-the-counter, OTC, medications for gastrointestinal symptoms and their onset of action. For immediate relief of heartburn, antacids like calcium carbonate work quickly by neutralizing stomach acid directly upon contact. Proton pump inhibitors such as omeprazole or H2 receptor antagonists like ranitidine and famotidine take longer to exert their full effect, typically hours, as they reduce acid production rather than neutralize existing acid. Therefore, for quick relief, an antacid is the best choice. Always consider the desired speed of relief when recommending an OTC product for symptoms like heartburn. Question 2. A prescription reads amoxicillin 250 mg per 5 ml. Take 5 ml 3 times daily for 10 days. How many milliliters of medication should be dispensed in total? A. 75 milliliters. B. 100 milliliters. C. 150 milliliters. D. 250 milliliters. Answer: C. 150 milliliters. This question requires a basic dosage calculation to determine the total volume of medication needed. The patient takes 5 milliliters 3 times daily, which means 15 milliliters per day, 5 milliliters x 3 doses. Over 10 days, the total volume required will be 15 milliliters per day multiplied by 10 days, resulting in 150 milliliters. Accurate calculation of total dispense quantity is critical to ensure the patient completes their full course of therapy. Always break down complex dosage instructions into daily and total requirements to avoid errors. Question 3. Which of the following best describes the primary role of a provincial college of pharmacists in Canada? A. To represent the interests of pharmacists in collective bargaining. B. To regulate the practice of pharmacy and protect the public. C. To negotiate drug prices with pharmaceutical manufacturers. D. To provide continuing education credits for pharmacists. Answer: B. To regulate the practice of pharmacy and protect the public. This question assesses understanding of the regulatory framework for pharmacy practice in Canada. Provincial colleges of pharmacists are self-regulating bodies established under provincial legislation, with their main mandate being to govern the practice of pharmacy to ensure public safety and maintain professional standards. While they may be involved in or support continuing education, their core function is regulation, including licensing, setting standards of practice, and handling complaints. Remember that the protection of the public is always the paramount duty of professional regulatory bodies. Question 4. A patient is prescribed warfarin. Which of the following laboratory tests is routinely used to monitor the effectiveness and safety of warfarin therapy? A. Hemoglobin A1C, HbA1c. B. International Normalized Ratio, INR. C. Liver function tests, LFTs. D. Renal function tests, RFTs. Answer: B. International Normalized Ratio, INR. This question tests knowledge of therapeutic drug monitoring for a common anticoagulant. Warfarin is an anticoagulant that works by interfering with vitamin K-dependent clotting factors, and its effect is monitored using the International Normalized Ratio, INR. The INR standardizes prothrombin time, PT, results, allowing for consistent monitoring across different laboratories and ensuring the patient's blood is at the desired level of anticoagulation to prevent both clotting and excessive bleeding. Monitoring INR regularly is crucial for safely managing warfarin therapy and adjusting doses as needed. Question 5. In the context of sterile compounding, what does the term beyond use date, BUD, refer to? A. The manufacturer's expiration date for the original drug product. B. The date after which a compounded sterile preparation should not be used. C. The date by which the compounded preparation must be administered to the patient. D. The date the final product leaves the pharmacy. Answer: B. The date after which a compounded sterile preparation should not be used. This question focuses on an important quality assurance concept in compounding, particularly for sterile preparations. The beyond use date, BUD, is assigned by the compounding pharmacist and represents the time and date after which a compounded sterile preparation, CSP, should not be stored or administered. Unlike a manufacturer's expiration date, the BUD considers factors like sterility, chemical stability, and physical stability of the specific compounded product under given storage conditions. Properly assigning and adhering to BUDs is essential for ensuring the safety and efficacy of compounded sterile preparations. Question 6. What is the primary purpose of a medication reconciliation process? A. To identify and resolve discrepancies between the patient's usual medications and those ordered upon admission or transfer. B. To update the patient's insurance information. C. To determine the cost-effectiveness of a patient's drug regimen. D. To obtain a complete medical history, including allergies. Answer: A. To identify and resolve discrepancies between the patient's usual medications and those ordered upon admission or transfer. This question tests understanding of a critical patient safety process in healthcare. Medication reconciliation is a formal process of comparing a patient's current medication list with the medications ordered at specific transition points in care, such as admission, transfer, or discharge. The main goal is to prevent medication errors, omissions, duplications, or incorrect dosages that can arise from incomplete or inaccurate medication histories. Implementing robust medication reconciliation significantly reduces the risk of adverse drug events. Question 7. A patient presents a prescription for a Schedule I drug. According to Canadian federal drug schedules, what characteristic applies to this drug? A. It can be sold only in a pharmacy by a pharmacist. B. It can be sold without a prescription in a pharmacy. C. It is available in general retail stores. D. It is an opioid with no accepted medical use. Answer: A. It can be sold only in a pharmacy by a pharmacist. This question assesses knowledge of drug scheduling in Canada, a key aspect of pharmacy law. Schedule I drugs, as defined by federal and provincial regulations, are those that require a prescription from a licensed practitioner and can only be dispensed by a pharmacist. This category includes most prescription medications, such as antibiotics and blood pressure drugs, emphasizing the need for professional oversight to ensure safe and appropriate use. Understanding drug schedules is fundamental to dispensing medications legally and safely. Question 8. A 6-month-old infant needs a dose of acetaminophen. The recommended dose is 15 mg per kilogram. The infant weighs 8 kilograms. How many milligrams of acetaminophen should the infant receive per dose? A. 60 milligrams. B. 90 milligrams. C. 120 milligrams. D. 150 milligrams. Answer: C. 120 milligrams. This question involves a straightforward weight-based dosage calculation, a common task in pediatric pharmacy. The recommended dose is 15 milligrams for every kilogram of body weight. Given the infant weighs 8 kilograms, the calculation is simply 15 milligrams per kilogram multiplied by 8 kilograms, which equals 120 milligrams. Accurate weight-based dosing is crucial in pediatrics to ensure both efficacy and safety, as children's drug metabolism and distribution differ from adults. Always double-check your calculations when dealing with pediatric patients. Question 9. Which of the following drug classes is commonly used as a first-line treatment for hypertension, high blood pressure, in many patients? A. Selective serotonin reuptake inhibitors, SSRIs. B. Angiotensin-converting enzyme, ACE, inhibitors. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. D. Macrolide antibiotics. Answer: B. Angiotensin-converting enzyme, ACE, inhibitors. This question tests knowledge of common first-line treatments for a prevalent cardiovascular condition. ACE inhibitors, such as lisinopril or ramipril, are widely recognized as first-line agents for hypertension due to their efficacy in lowering blood pressure and their beneficial effects on cardiovascular and renal outcomes. Other options listed are for depression, SSRIs, pain/inflammation, NSAIDs, or bacterial infections, macrolides. Understanding drug classes and their primary indications is essential for managing chronic diseases effectively. Question 10. What is a key characteristic of a look-alike, sound-alike, LASA medication pair? A. They are chemically identical but have different brand names. B. They belong to the same drug class and have similar mechanisms of action. C. They have similar appearances or names that can lead to dispensing errors. D. They require refrigeration and special handling procedures. Answer: C. They have similar appearances or names that can lead to dispensing errors. This question addresses a significant source of medication errors in pharmacy practice. Look-alike, sound-alike, LASA medications are drug pairs that either have similar packaging, labeling, look-alike, or similar pronunciation, sound-alike, which can lead to confusion and dispensing errors. Examples include Celebrex and Celexa, or hydralazine and hydroxyzine. Implementing strategies such as tall man lettering, separating LASA drugs on shelves, and requiring independent double checks helps mitigate the risk of these types of errors. Always be vigilant for LASA medications to enhance patient safety. Question 11. A pharmacist receives a prescription for azithromycin 500 mg x 3 days, then 250 mg x 2 days. What is the total quantity of azithromycin 250 mg tablets that should be dispensed to the patient? A. 5 tablets. B. 7 tablets. C. 8 tablets. D. 10 tablets. Answer: C. 8 tablets. This question requires calculating the total number of tablets needed for a tapering dosage regimen. The prescription indicates 500 mg per day for 3 days, which means 2 tablets of 250 mg per day for 3 days, totaling 6 tablets, 2 tablets/day * 3 days. Following this, the patient takes 250 mg per day for 2 days, which means 1 tablet of 250 mg per day for 2 days, totaling 2 tablets, 1 tablet/day * 2 days. The grand total is 6 tablets plus 2 tablets, which equals 8 tablets. Carefully breaking down complex dosing schedules ensures the correct quantity is dispensed. Question 12. According to generally accepted principles, which of the following is considered a controlled act in pharmacy practice in Canada? A. Selling an over-the-counter pain reliever. B. Counseling a patient on how to take their medication. C. Preparing a sterile admixture for intravenous administration. D. Accepting a prescription from a patient. Answer: C. Preparing a sterile admixture for intravenous administration. This question tests understanding of the concept of controlled acts within pharmacy scope of practice. In many Canadian provinces, controlled acts are specific, high-risk activities that can only be performed by regulated health professionals who have the training and authority to do so, such as dispensing medications, administering injections, or in some cases, compounding sterile preparations. While pharmacists routinely perform all the listed activities, preparing sterile admixtures often falls under a specific category of controlled acts due to the specialized skills and risk involved. Always refer to your provincial regulatory body for the exact definition of controlled acts in your jurisdiction. Question 13. Which of the following conditions is celecoxib, Celebrex, primarily used to treat? A. Bacterial infections. B. Hypertension. C. Pain and inflammation. D. Depression. Answer: C. Pain and inflammation. This question tests knowledge of drug indications for a common nonsteroidal anti-inflammatory drug, NSAID. Celecoxib, Celebrex, is a COX-2 selective NSAID primarily used to reduce pain and inflammation associated with conditions such as osteoarthritis, rheumatoid arthritis, and acute pain. Unlike non-selective NSAIDs, it aims to reduce gastrointestinal side effects. Understanding the primary therapeutic use of medications is crucial for appropriate dispensing and patient counseling. Question 14. What is the appropriate initial response if a pharmacy technician identifies a potential drug allergy interaction during prescription processing? A. Dispense the medication and inform the patient to monitor for allergic reactions. B. Contact the prescriber immediately to clarify the prescription. C. Override the alert and proceed with dispensing if the pharmacist is busy. D. Consult the pharmacist for assessment and intervention. Answer: D. Consult the pharmacist for assessment and intervention. This question focuses on the crucial role of pharmacy technicians in patient safety and their professional responsibilities. When a potential drug allergy interaction is identified, the pharmacy technician's appropriate initial action is to consult with the supervising pharmacist. The pharmacist is responsible for assessing the clinical significance of the interaction, determining the best course of action, e.g., contacting the prescriber, recommending an alternative, and providing patient counseling. Technicians should never override alerts or dispense medications when such a critical issue is detected without a pharmacist's review. Question 15. A patient is prescribed metoprolol. Which of the following is a common side effect of this medication? A. Cough. B. Bradycardia, slow heart rate. C. Constipation. D. Hyperglycemia, high blood sugar. Answer: B. Bradycardia, slow heart rate. This question assesses knowledge of common side effects associated with beta blockers. Metoprolol is a beta blocker primarily used to treat hypertension, angina, and heart failure. A common side effect of beta blockers is bradycardia, or a slowed heart rate, due to their mechanism of action in blocking beta-adrenergic receptors in the heart. Patients should be advised to monitor their heart rate and report symptoms of excessive slowing. Recognizing common side effects is vital for patient education and monitoring. Question 16. A prescription calls for 100 milliliters of a 0.9% sodium chloride solution. How many grams of sodium chloride are needed? A. 0.09 g. B. 0.9 g. C. 9 g. D. 90 g. Answer: B. 0.9 g. This question involves interpreting a percentage concentration and performing a simple calculation. A 0.9% with V sodium chloride solution means there are 0.9 grams of sodium chloride in every 100 milliliters of solution. Since the prescription calls for 100 milliliters of this solution, exactly 0.9 grams of sodium chloride would be needed. Understanding percentage concentrations is fundamental for accurate compounding and dispensing of solutions. Question 17. Which of the following statements about the storage of insulin is correct? A. Insulin vials can be stored at room temperature, below 30 degrees Celsius, for up to 3 months once opened. B. Insulin should always be stored in the freezer to prolong its shelf life. C. Unopened insulin vials should be stored in the refrigerator between 2 degrees Celsius and 8 degrees Celsius. D. Insulin is stable indefinitely at room temperature once opened. Answer: C. Unopened insulin vials should be stored in the refrigerator between 2 degrees Celsius and 8 degrees Celsius. This question tests critical knowledge regarding the proper storage of insulin, a temperature-sensitive medication. Unopened insulin vials, pens, or cartridges must be stored in the refrigerator, typically 2 degrees Celsius to 8 degrees Celsius, to maintain their stability and efficacy until their expiration date. Once opened, most insulin products can be kept at room temperature, usually below 30 degrees Celsius, for a specified period, typically 28 days, but not indefinitely or for as long as 3 months. Proper storage is vital to ensure the medication remains effective for patients. Question 18. What is the primary reason for conducting a final check by a pharmacist before dispensing a prescription? A. To verify the patient's insurance coverage. B. To ensure all fees have been accurately processed. C. To confirm the prescription is clinically appropriate and accurately dispensed. D. To record the dispensing time for inventory management. Answer: C. To confirm the prescription is clinically appropriate and accurately dispensed. This question highlights a fundamental aspect of quality assurance and patient safety in pharmacy. The final check by a pharmacist is a critical step designed to ensure that the dispensed medication is clinically appropriate for the patient and that all aspects of the prescription have been accurately prepared and labeled. This includes checking for drug interactions, correct dosage, proper labeling, and overall suitability for the patient's condition. This final verification helps to catch any errors that may have occurred during processing, safeguarding patient health. Question 19. A patient is prescribed gabapentin. For what condition is gabapentin most commonly prescribed? A. Acute bacterial pneumonia. B. Type 2 diabetes mellitus. C. Neuropathic pain or seizures. D. Allergic rhinitis. Answer: C. Neuropathic pain or seizures. This question tests knowledge of common indications for specific medications. Gabapentin is an anticonvulsant and analgesic medication primarily used to manage neuropathic pain, such as postherpetic neuralgia or diabetic neuropathy, and as an adjunct therapy for partial seizures. While it can have other off-label uses, its main therapeutic roles are in these conditions. Knowing the primary indications helps in understanding patient needs and potential side effects. Question 20. Which of the following is an example of a critical incident that must be reported in a pharmacy? A. A patient picking up their prescription 30 minutes late. B. A pharmacist giving incorrect advice about an over-the-counter cough syrup. C. A dispensing error where a patient received the wrong medication, resulting in harm. D. A new medication being out of stock for 1 day. Answer: C. A dispensing error where a patient received the wrong medication, resulting in harm. This question defines a critical incident in the context of pharmacy safety. A critical incident is generally defined as an unintended event that results in harm to the patient or has the potential to cause serious harm. A dispensing error leading to patient harm is a clear example of such an event that necessitates formal reporting and investigation to learn from the error and prevent recurrence. Timely reporting of critical incidents is crucial for improving patient safety and quality assurance within the healthcare system. Question 21. What is the primary role of a pharmacy technician in a community pharmacy setting? A. To counsel patients on their medications. B. To perform final clinical checks on prescriptions. C. To assist the pharmacist in dispensing and administrative tasks. D. To diagnose medical conditions and prescribe medications. Answer C. To assist the pharmacist in dispensing and administrative tasks. This question clarifies the scope of practice for pharmacy technicians. The primary role of a pharmacy technician is to support the pharmacist by performing technical and administrative duties, such as receiving prescriptions, entering data, preparing medications, managing inventory, and processing billing. These tasks free up the pharmacist to focus on clinical patient care, counseling, and final checks. Pharmacy technicians work under the direct supervision of a pharmacist and do not perform clinical assessments or prescribe medications. Question 22. A patient asks about the beyond use date, BUD, for a commercially manufactured prescription bottle of ibuprofen tablets that has been opened. What information should the pharmacy technician provide? A. The BUD is typically 1 year from the date of dispensing, regardless of the manufacturer's expiry. B. The BUD is usually 6 months from the date of opening. C. The manufacturer's expiration date on the bottle should be used, unless it's within 1 year of opening. D. There is no BUD for commercially manufactured solid oral dosage forms once opened, only an expiry date. Answer D. There is no BUD for commercially manufactured solid oral dosage forms once opened, only an expiry date. This question distinguishes between manufacturer expiration dates and beyond use dates, BUDs, for different types of medications. For commercially manufactured solid oral dosage forms, like tablets or capsules, in their original container, once opened, the manufacturer's expiration date still applies. A BUD is specifically assigned to compounded preparations or multi-dose vials, like insulin, reflecting a shorter shelf life due to stability or sterility concerns post-compounding or opening. It is important to remember that for typical commercial products, the printed expiration date is the guide. Question 23. What is the term for the process of comparing a patient's prescription with their medication profile to identify potential drug interactions or contraindications? A. Inventory management. B. Therapeutic drug monitoring. C. Drug utilization review, DUR. D. Adverse event reporting. Answer C. Drug utilization review, DUR. This question focuses on a crucial quality assurance and patient safety process in pharmacy. A drug utilization review, DUR, is a prospective, before dispensing, concurrent, during therapy, or retrospective, after therapy, review of prescription drug claims and patient records to ensure appropriate, safe, and effective medication use. It identifies potential problems such as drug interactions, contraindications, duplicate therapies, or inappropriate dosing. Performing a DUR helps optimize patient outcomes and reduce medication-related problems. Question 24. A patient reports muscle pain and weakness after starting a new cholesterol-lowering medication. Which class of drugs is most likely responsible for these symptoms? A. Angiotensin II receptor blockers, ARBs. B. Beta blockers. C. Statins. D. Thiazide diuretics. Answer C. Statins. This question tests knowledge of common adverse effects of a widely prescribed drug class. Statins, HMG-CoA reductase inhibitors, such as atorvastatin or rosuvastatin, are highly effective in lowering cholesterol but are well known for their potential to cause muscle-related side effects, ranging from myalgia, muscle pain, to more severe conditions like rhabdomyolysis. Therefore, muscle pain and weakness are highly suggestive of a statin-induced adverse effect. Always counsel patients on potential side effects and when to seek medical attention. Question 25. What is the maximum daily dose of acetaminophen for an adult with a healthy liver, unless otherwise directed by a healthcare professional? A. 1,000 milligrams. B. 2,000 milligrams. C. 3,000 milligrams. D. 4,000 milligrams. Answer D. for 1,000 milligrams? This question addresses an important safety guideline for a common over-the-counter medication. For adults with a healthy liver, the generally recommended maximum daily dose of acetaminophen, Tylenol, is 4,000 milligrams, or 4 grams, from all sources. Exceeding this limit can lead to severe liver damage. However, many healthcare professionals recommend a lower maximum, such as 3,000 milligrams, to provide an additional safety margin, especially considering the potential for accidental overdose from multiple products containing acetaminophen. Always advise patients to be aware of the total daily intake of acetaminophen from all medications.